Steve Adubato here, another important program on oral health. We are joined by Dr. Cavan Brunsden.
Yes.
Who is a pediatric dentist, and he just told me before you get on the air, this can't be true. You've been at this for 51 years?
51 years since I began the profession of dentistry in 1975.
Now, you just said that about 10 years ago, you thought maybe you might change plans, and then what happened?
Well, what happened was about 10 years ago, I was thinking of my transition into the next phase of my life. And my practice began to blossom in managing autistic children. And as I cared for them and had to develop systems to properly manage them, I became more and more enthused about what I was doing and the importance of it. And working with my team in my office, we have 50 employees who we train and dedicate to managing these children, from the business front of the office to the management of the children, through the dentistry. And we've developed such phenomenal systems that I feel really empowered to help these other dentists develop themselves into being the future. So it's a very exciting part of what I'm doing.
Sorry for interrupting, Doctor. You talk about children with autism. What unique issues do they face when it comes to their oral health?
Well, probably the single most significant issue is that autistic children are patternistic, repetitive behaving people. They don't take to new experiences very well, especially later on in their years. If I see an autistic child at age 1, 2, or 3, they're very easy to manage, develop, and train into the systems of going to the dentist, for example. However, if I see that same child at 7, 8, or 9, very difficult to come in and change their ways in their lives,
because
leading
of patterns?
to, pardon?
Because of their patterns already?
Yeah, they're very patternistic. They don't transition well. They don't take to new things easily. It takes many, many, many months to change an autistic child's acceptance of a situation. I have a child in my office. The mother tells me that in the summer it takes her 3 months to transition him from long pants to short pants. What a project for a mother to have to deal with. Can you imagine having to deal with brushing his teeth, taking care of his oral health, taking care of all of the other needs, feeding him the right foods, things of that nature? It's a full-time job for a talented person, and most moms are not.
So let's talk about this. For children who do not have autism, but are still challenged when it comes to oral health, give some advice to the rest of us, parents, who are trying to deal with and figure out the oral health of our children. When should a child first see a dentist?
Yeah. The issue of challenging children is, I think all children are born to challenge their parents on every issue.
It's their job.
Yeah, and I think it's parents' job to convert them over to being disciples.
Explain
Disciples are converted by teaching them discipline. Discipline is taught by doing, not discussing. I believe that parents should take control of the issues and make them happen. In a young child, it's not about conversing about what's right, what's wrong, what are the risks, what are the benefits. It's about getting things done.
Explain it. Example.
Well, if you have a 1-year-old who has 6 or 8 teeth in their mouth that need to get them brushed, well, you need to brush them every day. And a 1-year-old may not permit you to do that. And you might sit there and sing a song, you might read them a book, you may play with some poets. Well, when all the books and the puppets are on the floor and you're angry and annoyed, your baby is still challenging you, your baby has won. Well, what you should do is take the child, put them between your legs, put your legs over them like this, hold their head up like this, pick up the brush, and scrub their teeth for 10 seconds and let them go. No talk, no conversation. You've sent a message, you've controlled the situation, your child has learned.
Stop talking about it?
Yeah, stop talking.
How about
just
when they're
get
6?
to it.
Our daughter, as we do this, happens to be 6, and we talk about it a lot.
Right. Stop talking about it. Yeah. Put a calendar up. 30 days, you get whatever you want. But you have to prove to me every day with a photograph on my phone sent to me that I just brushed my teeth, and you'll get whatever you want. Do that for 10 days. Do it for 20 days. Whatever you decide works. But show the child that there is a benefit to what you're asking them to do. But also show the child that you trust them to be responsible. Because that's what it is, responsibility.
Connect what you're just describing between brushing your teeth, and we'll talk about flossing in a second. By the way, when is flossing appropriate for a child?
Well, we recommend flossing as soon as teeth touch.
Really?
Yeah. Now, many babies, their teeth don't touch until they're 4 or 5 years of age.
Okay.
But it's really important to begin showing flossing around 3. The reason is it becomes a patternistic behavior because all children are patternistic. All children are repetitious if you bring these concepts in early on. Most parents wait until they think their child's old enough to do something. Doesn't work that way.
Too late.
Proceed it with the lesson when it's simple, when it's easy, when it's not complicated, and when, if they fail at it, it does no harm. You don't want to start introducing a technique to prevent a disease while the disease is in process.
You have a dental center.
Yes.
At Rutgers?
We have one center at Rutgers, and then I have my own private center called KidsDent.
You created that in '85.
KidsDent started in '85 in Old Bridge, New Jersey, and it's a center dedicated to infants, children, adolescents, and special needs children.
And your wife is also connected to oral health?
Yes, my wife, Nancy Villa, is the director of our orthodontic department, and she does orthodontics for children and adults, and she's also my consultant for orthodontics for autistic children, because we actually take children into our office who have severe dental problems, and we sedate them, and we put braces on their teeth, and we correct their dental problems.
Where did your passion come from? Where does your passion come from for this work, for these children?
Well, I've always been very passionate about working with kids. Before dentistry, I was a 6th grade school teacher in Paterson, New Jersey, Carroll and Hamilton Street, school number 6. I was there for 3 years, and then I went to Englewood, New Jersey, where I was a science director for a junior high school, and I became their assistant principal. During that time, I went to school at night to get my degree in biology, my master's in physiology, and suddenly got accepted to dental school. In the 70s, when I went to dental school, preventive dentistry didn't exist.
Yeah.
It was restorative dentistry. Everybody fixed damaged people. Most of them were adults. Most dental practices succeeded on managing adults. I felt in my heart and soul that that was a wasteful time to spend your life. I preferred to change the world a little bit at that time. I knew if you work with children, you can really make a difference. So I got involved with kids. I had great mentors up at the dental school. Ed Sonnenberg from Denville, he's practicing today. He was one of my mentors that gave me a philosophy that has pervaded me to this day.
Well, you continue to make a difference, and your passion is obvious. And
not only for me and the kids that I treat, but my staff and the people who are going to carry this on after me.
Doctor, thank you. We appreciate everything you do.
You're very welcome.
Stay with us. We'll be right back.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Caldwell University, PSE&G, the Give Something Back Foundation, Gary's Wine and Marketplace, Fedway Associates, the New Jersey Office of the Insurance Fraud Prosecutor, and by the Russell Berry Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.